Hey people, welcome to Doctor Academia and another episode of OPD series where we'll be describing about wound certificates. Certificate, which has the utmost importance when you're working as a medical officer in a government or a private setup in India. So let's see a little bit about it. This is an image of an accident or a wound certificate that I got from Google, and let's see what it is. See, when you get a patient who has an alleged history of assault or an accident, or when you're suspecting it, you are bound to write a wound certificate. And when a patient comes, you have to write here the date and time of examination. Say today is September 9th, then you have to write here the date you are writing it and the time you are starting it. Then name of the patient, age, sex, his entire address, identification marks if possible from two different sites. Here you have to write the name of the person who is accompanying the patient. You have to write his or her name and here phone number. History of the entire history of the injury, how it has happened. So you have to write in detail scenery of how the patient has procured that injury, and it should be in detail. If the history of the injury was said by the patient or anyone else, then details of injuries, which has the very utmost importance. Findings of physical examination is actually what you have learned in your MBBS, that is the general physical examination. Which includes RS, CS, CNS, GI, then adult ictus, nurses, any kind of impairment, disability, and the overall lookout. Right here. Then, based on observation, whether the patient is needed to be admitted for just observation or as an outpatient, expired, or the patient is referred to any kind of specialty opinion. Then last, based on the judgment and based on the appearance of patient and what has occurred, you have an idea if it is the injuries are alleged or not. Could be alleged or could not be. You have to write the date and place of where you have conducted that examination and whatever signature and designation you are in. Certificate can be written by any casualty medical officer or any medical officer in case who are working in a government or a private setup, and you should be ready to write whenever patients present to you with such complaints of assault or an accident or any injury which you suspect of. And the certificate will be present in an accident or emergency register, which will be kept in every hospital whenever it is needed. A wound certificate has two copies. One copy should be given to the police for the investigation, and one copy should be kept in a hospital for any kind of future reference. And if it goes for a court case, if it becomes a court case, then you have to submit these documents whenever it is asked for. Now, details of wound is one of the most important topic, and where should be in complete detail. So, the nature of the wound, you have to write there whether it is an abrasion, contusion, laceration, or an incision. Size, shape and direction of the wound is very important, which is also used for describing the scene of crime. Which part of the body has procured the injury, whether it is simple or grievous hurt, which is also very important, whether it is caused by any kind of weapon. So let's see what a grievous hurt is. What kind of injuries can be categorized as a grievous hurt? Grievous hurt comes under section 320 of IPC, and what all injuries are included under it. It includes emasculation, permanent privation. Privation means if it has lost the quality permanently or not. Permanent privation of sight or eye, permanent privation of hearing or ear, member or joint, permanent impairment of power of any joint, that it has brought weakness or complete loss or complete function of any joint, disfiguration of head or face, fracture or dislocation of bone or teeth, unable to follow ordinarily for a period of 20 days. That means if he has got into an assault or an accident and he is bedridden for a period of 20 days, it is also considered as grievous hurt. Simple hurt that comes under section 319 of IPC, which include any kind of bodily pain, disease or infirmity caused to any person, which is neither extensive nor severe and which heals abruptly. And most of the cases comes like this, so you should be ready to differentiate between simple hurt and grievous hurt. Extra points, which is actually an extra IPC sections, which if possible you should remember it. Some of these are asked in neetpg also. Section 321 IPC is for voluntary causing a simple hurt. If it is section 322, it is a grievous hurt. Section 323 IPC is a punishment for voluntary causing a simple hurt. Section 325 is a punishment for voluntary causing a grievous hurt. 324, if you are voluntary causing a hurt by means of a weapon, it comes under section 324. That means if the patient is beaten up with a stick or an axe, then it comes under section 324. Section 326, voluntary causing grievous hurt by dangerous weapons or means. Yeah, if it is cut by a knife, if he is chopped by an axe, then it comes under grievous hurt. That and the punishment of it, and if it is voluntary cause, it comes under section 326. Here's just hurt. This is grievous hurt. So if the use of the acid, then it comes under 326A if it is voluntary causing the injury by an accident, and 326B and voluntary throwing or attempt to throw comes under 326B, and voluntary using grievous hurt using acid, if it is caused and grievous hurt, then it comes under 326A, and attempt comes under 326B. Marking here has been asked in neetpg previous questions, so try to remember it. So writing a wound certificate in a medical setup is very important, because once it has gone to a court case, you will be asked to describe these details inside the court also. So when you're writing a wound certificate, it should be in great detail, and then you should be in a situation to describe the wound in great detail also.